Good morning. It's Monday, the 6th of April, and welcome to our daily COVID Task Force meeting. We're going to start at the board, and Tiffany, if you will roll in, please. So this is today's current map, right hot off the press. You can still see that New York continues to be a major problem in the country, and the numbers there are expanding. When you come down here to South Florida, things look a little better. Yes, Miami-Dade continues to represent the largest outbreak here in Florida. More than 50% of all cases are in that region. This is the Pinellas area right in here, and we continue to be pretty stable. That's a good news. One of the other things that stood out in my mind is look out here on the West Coast in San Francisco and then up in Washington State, the King County, Seattle area. Both of those had early numbers, and they look to be developing as a hot spot. In fact, we're going to flip back over and look at the map from 320. Look how significant the outbreak was back in 320. So here's another one of the early indicators that once you start practicing good social distancing, you identify the cases, you are in fact able to flatten this curve. There's been in 10 days pretty significant improvement in both Washington and the San Francisco area. All right, we're back at the table, and I wanted to get started by looking at the statistics for the state and our local area. So pretty significant change in the state of Florida from Friday. Friday we had 6,700 cases in the state of Florida. This morning it's up to 12,350. The death toll in Florida has climbed from 85 to 221. Here in Pinellas County, we also went up from 167 to 359, and our death count grew from 5 to 8. Pasco County doubled. They went from 40 to 98, but their deaths remained at 2. Probably the most significant change comes nationwide, where Friday we had 189,000 cases, and this morning we have 337,000 cases, and the death count doubled from 4,081 to 9,653. So the president and his National Health Board have talked about this being a critical week in this battle to defeat the virus. I'm sure you're watching all the news stations and getting this information as well. But over the next 7 to 14 days, this is the crunch time. This is where it's going to happen. These numbers, unfortunately, the government says will continue to rise, and the virus over the next 10 to 14 days is going to become more prominent in all of our lives. So now is the time for us to practice really good social distancing and make sure that we really up our efforts in trying to stop the spread of this virus and keep residents at Regency Oaks safe. One of the things that I wanted to talk to you about this morning was the use of our side doors. We have been monitoring the fob use, and we know that there are a number of folks who are leaving the building and not reporting to the front desk upon returning. We're able to track that because we're able to see how many exits are occurring, how many entrances are occurring through the electronic fob system, and then we have our temperature logs at the front desk. And there is a pretty big discrepancy between the number of people who are leaving and returning and who are checking in at the front desk to have their temperature checked. the single most important thing that we can do to help fight this virus here at Regency Oaks is to monitor your temperature on a daily basis, particularly if you are leaving the campus. So effective tomorrow morning, Tuesday morning, we are going to be locking down all of the side entrances in the IL buildings. All residents and any of your healthcare surrogates who might be coming to your apartment are going to be required to come into the buildings through the front doors. I know this is an inconvenience and I know it creates difficulties, but given the fact that the governor has asked that everyone stay at home, that you not travel, that you this week not even go to grocery stores, we think this is the next step necessary to make sure we are protecting residents and keeping the virus from spreading throughout the campus. I truly appreciate your support and understanding, and I know I have your cooperation of helping us all keep our neighbors and our staff safe. Okay, one of the things that I thought you might find informative is to actually hear from Rance Macy, our skilled nursing home administrator over at the health center. Rance and his team are on the front line. They are the ones who every single day are making sure that our residents who are ill or infirmed, that they're safe. Those are the most vulnerable people in our population. And I just am so proud of Rance and our skilled nursing team and all that they've done to make sure that our residents are safe and that we're protected against this virus. Rance, maybe you could share with us some of the safeguards you've been enacted.
Thank you for those kind words. So we're at the health center. We're doing daily check-ins with AHCA. AHCA is the Agency for Healthcare Administration that oversees us. Every day at 10 a.m. we have to fill out a questionnaire for their website to let them know what our status is as far as do we have any cases, which we don't. Do any of our employees have any cases or suspected cases? They don't. And then what our PPE status is, which we are low in a lot of areas, especially gowns. In addition to that, AHCA calls once a week just to do a over the phone interview with me, just to ask about basically the same questions. I guess they just want to hear it from my voice. And same questions, do we have any suspected cases? What are we doing to limit exposure? How's our PPE? In addition to AHCA calling us every week, the Department of Health checks in also. And I have to say the Department of Health's been very helpful because they've actually brought us some PPE. They dropped off a box of gowns last week and some masks and some gloves. So by checking in with them, they're able to free up some PPE when it's available, which is beneficial to us. I also wanted to talk about our medical director. Some of you know him. He's Dr. Khalil. He's one of the head hospitalists at East Countryside Hospital. He's on the front lines of this thing, fighting it at the hospital. He's dealing with it every day. So I just would like to recognize him. He's one of our heroes. And over at East Countryside Hospital, it's designated a COVID center. So he's basically leading that task force right now, helping fight it there. And finally, I just want to talk about what we're doing for the residents over there. We're scheduling FaceTime with families so the residents can talk to their families with the iPads that we have available over there. Unfortunately, activities are limited over there as they are over here. So we are doing hallway bingo, which is help the residents have a little bit of a smile during this time. And that's about it. I mean, the staff's going good. The residents are safe right now, and we're very happy with that we have no cases and we have no suspected cases. Thank you.
All right. Thank you, Rance. And now to wrap up with just a few last changes, we're going to turn it over to Leslie, our Director of Resident Services, for an update.
Thank you, Brant. Just wanted to inform our residents that LCS is allowing our staff to have negative paid time off during this unsteady time. So it'll help them with any childcare needs for them. And again, it's a great way to show LCS is supporting us during this. I want everyone to look out for Tuesdays and Thursdays of Zelco's 25-minute workouts. So make sure that you're still getting all your stretches and movements in during these quarantine times. So look out for that. It'll be coming soon. Also, Friday, You're going to be looking forward to some Easter bunny surprises, so when you're in your apartments, just keep a lookout outside. Also on Sunday, you'll be receiving a spectacular dinner from Ricky and his staff for Easter Sunday. Thank you.
All right, thank you, Leslie. So just in concluding for today, this is going to be a tough week. You've already been warned by the president that the numbers are not going to be good this week. It's easy to get discouraged, but there is light at the end of the tunnel. Pinellas County numbers continue to remain stable. We continue to have no cases here at Regency Oaks. We are not tracking anyone, either resident or staff, of having suspected COVID symptoms. We've done a really good job as residents and staff in making sure that our building is secure and that we're following all the recommendations of CDC and the governmental agencies. We need another couple of weeks. It's going to be tough. I know everyone is isolated and feeling like they're missing the quality that we bring to life. You're not able to gather with friends or family. You're going to miss an Easter celebration with loved ones. I know it's tough. Let me just ask for 2 more weeks. We can get through this together. We can make sure that no one loses their life here at Regency Oaks. Let's be safe. Let's practice good social discipline, and let's fight this out. 2 more weeks. Everybody have a great day, and we'll be back on Wednesday. Thanks.